Hello, I'm Kathy Chester, and this is Move It or Lose It, a podcast about all things that move the mind, body, spirit, and soul.
Hello, welcome to another week of Move It or Lose It podcast, where we talk about all things that move and all things that we are learning about our autoimmune diseases. And today I am so excited about my guest, Dr. Rachel Sullivant, who is a doctor who does neurochiropractic. And I know that you're a neurochiropractor. And I went to visit the facility yesterday and it was awesome. It's in Flint, Michigan. I'm in Royal Oak, Michigan. And I just think that this is such a great time in the autoimmune world that we get to understand things that we may not have before COVID. So without any further ado, Dr. Sullivant, I introduce you. Thank you so much for being on.
Hi, thanks for having me. Happy to be here.
Thank you. So Dr. Sullivant, I was able to come in yesterday and be able to kind of view what exactly it is, because I was confused 20 years in, and I had no idea that this existed.
Sure.
And I think a lot of us don't know what we have access to, that we have neuro everything, that we can go to a neuroophthalmologist. I have a story that I will tell with a neuroophthalmologist that I have coming on, that I was diagnosed by an ophthalmologist. And it wasn't until years later that they said something to me like, even an ophthalmologist can see optic neuritis with the naked eye. And I was like, what if we missed all these years? And why was that not something promoted and given to us? So when I found you, I was super excited about this because when I'm excited to see the comments and the feedback I get, because when we think about a chiropractor, you think the pop, and all that, but this is completely different. So I want to highlight, so give me some, I know you went to Michigan, go blue, go blue.
So, yeah. So I did my undergrad at U of M in Ann Arbor, and I studied neuroscience there. And then from there, I went to chiropractic school out in the Bay Area of California at Life West.
That must have been horrible.
Yeah. It was hard to come back.
Hard
to come back to Michigan. But before I went there, I had worked at a chiropractor's office in high school. And that was kind of my first exposure to functional neurology and that side of chiropractic.
I saw that.
Yeah, we had a doc there that he specializes in the same thing that I've specialized in. And so that was kind of my first exposure. And so when I got to school, I kind of immediately got into this program called through this institute called the Carrick Institute. And Carrick, he's sort of the guy that's kind of pioneered functional neurology or clinical neuroscience. There are a couple different names that we call it. So he's kind of taken this subset of chiropractic neurology and given docs the tools and the training that they need to be able to practice this. So, so when I got into school, I got right into that program. So I did 300 hours or more than that, of postdoctoral studies. And then I sat for a special board exam once I was done with school. And so that has given me the tools to kind of do this kind of work.
Yeah, which I love. And it was obvious when I visited yesterday that this is something that you're very passionate about. The fact that you took time out to do a test with me and show me some things. So what drove you, and from going from the normal chiropractic avenue and then taking you to this, what about the neural part that really intrigued you? What is it about that?
So kind of like from a personal story, I grew up with chronic migraines, started getting them when I was 7 years old. really debilitating when I was younger. And nobody could really give me answers as to why. I went to a bunch of different doctors. I went to neurologists, and nothing really, seemed to make a difference for me. And then I had known about functional neurology, obviously through my job. And then when I got to school, I sought out a functional neurologist in the area, to get my own treatment. And that was really the thing that changed headaches for me quite a bit. I still get headaches, but it's not like it used to be for me. It's become a management thing. And I've learned tools to kind of improve the quality of my life. And keep me from having so many bad days. So, for instance, when I was in college, undergrad, I was probably getting like 3 or 4 migraines a week. And now I'm getting what I would equate to the same level of those migraines. I probably get a couple every couple months. So maybe a half dozen a year.
And so for us in the autoimmune world, like we live in chronic migraines are a big thing for me and a lot of the clients that I train. And it's daily. It's a daily migraine, whether it's behind the eye, from optic neuritis or stress or, whatever the fun, MS autoimmune things that are happening. And so for this, I don't think that anyone thinks about going to a chiropractor to release their migraines. And that's why I believe it's so different than what you think of when I think of going to the chiropractor. I think I don't want to be popped and I don't want my neck all sore. It's not appealing to me. So explain, like I got to come in yesterday, talk about the test that you did with me yesterday that I realized I didn't do so well in. I was like, oopsie.
So we just did one little basic test that's kind of part of our whole neuro exam. Because when we do a workup on somebody, it's very thorough. We look at a lot of different things because we want to try to be as specific as we can be. So the test that we did yesterday, we did some blind spot mapping. This was actually one of the things I learned first in school. I was in the neuro club, and so we were practicing this in club, and it's a nice tool to use, especially when you're trying to educate a patient. So basically we go through and we map out your blind spot. And ideally, when we look at somebody's blind spot, it should be a small region, quarter size, and, not be much bigger than that, because your brain should be good at filling that information in for you. But sometimes when we have different conditions going on, whether it's an autoimmune condition, migraines, concussion, a bunch of different things.
Did you work with stroke, like all sorts of
stroke? So when you've got some brain-based condition going on, what we can find sometimes is that the brain isn't as good at filling that information in. So,
which I noticed yesterday, which I thought I was doing a great straight, which by the way, this will be in a video. So you'll see the test that we did yesterday. And like Dr. Sullivant says, it's just one of the basic tests, but something that you can get an idea how different this is than going to a regular chiropractor.
And like I said, it's something that we kind of use more educationally. And like, the nice thing about it is I can show a patient, hey, look, you can see, obviously there's a huge difference from one side versus the other. Your blind spot on this side, really big, that brain's not filling that information in. And then what we can do kind of quickly there is maybe do a quick little treatment. Sometimes I'll adjust a couple fingers, or we might put a tuning fork in the ear, and we just see if there's a change, and we just remap it. And if we see a positive
putting something in the ear, sometimes that can be.
So a lot of the work that we do in functional neurology, we pull treatment techniques from a lot of different things. So neuro-ophthalmology, OT, PT, chiro, they're all sort of tools in our tool bag. And so a lot of a lot of work that I do, I use different types of stimulus to stimulate the brain or the nervous system in the right way. So sound can be something we use, smell, vision, obviously, motor, movement. That's another one. So there's all these.
When I went through, I was like, all of the things that we struggle with. So it's so important. And I'm definitely coming to see you. That's for sure. I was so impressed with the facility. It's gorgeous. And how you just, so let's say I'm going to come in a day. Okay. And my symptoms are the migraines, which we talked about, but then I've got just extreme with my day. And as a trainer, even though I'm training my MS and my autoimmune clients for movement and functional movement, right? Connecting the mind and the body. Let's say my shoulders and I'm having a lot of drop foot and things like that. Where would we go from there?
So like I said, we would start with a really thorough exam. We'd be looking at your motor function, your peripheral nerve function, your sensory function. I really look at the eyes quite a bit when we do our workup. So there's different programs out there where you can have some like high tech equipment that will track and record your eye movements and plot it out on a nice graph. You don't necessarily need that though in practice. So I look at, how your eyes are moving passively, how they're moving voluntarily, slow versus fast. We look at a reflex, your optokinetic reflex, and then we take all that information and that helps us kind of narrow down, okay, what side of the brain do we need to work on? What particular lobe do we need to work on? Or maybe we need to work on a peripheral thing. Maybe you've got some issues, in your forearm that we need to work on too. So it just kind of helps narrow
and you
us
can
down.
Find that all out by doing fascinating.
Yeah. And so we just use all these different tests. We do a lot of cranial nerve tests and bring that all together. Now there's some docs too that functional neurology, the beautiful thing about it is you can kind of make it what you want it to be. Every case is so different and every patient is different. So each program is really tailored to the patient. And there's some docs that do a lot of nutritional counseling with theirs. There's some that do hormone testing. I look at structure a lot because I am a chiropractor. So if we can do some structural work too, we will. So we just kind of use all that information to really give that patient a really specific course of treatment.
Now, Dr. Sullivant, I was going to ask, so if a patient just comes in and they are, and they're dealing with 2 different autoimmune diseases, things like that, which I'm sure you've seen before, and just issues with eye stuff and issues with cognitive stuff. Is there anything in chiropractic and what you do that would help with that as well? Because a lot of my clients I work with cognitively, we make it funny because we have to, or we'll go nuts. But it's a big thing. It's a big deal.
Yeah, there's a lot of different things I use. So, in terms of autoimmune, I mean, I know you know this well, diet is huge in autoimmune.
Absolutely.
So if that patient's not already on, a nutrition program specific to whatever they have going on, that is definitely something we need to work on, cleaning up the gut. Number one. The other thing, so with vision, the nice thing about those tests that we do when we look at your eyes and how they're moving, we can turn a lot of that movement that we're seeing not work so well into therapy. So I have like a program that I use where I can build an eye exercise for a patient, and then we use that as a therapy. And I'll give people the exercises to do at home. We'll do them in office. Sometimes we'll throw in, I recently had a patient. So when we were doing her exercises, while she's doing her eye exercises.
I like your tattoo, by the way.
Oh, thank you. It's my chiro tattoo.
Oh, I love it.
I got a cervical bone there.
Oh, interesting. I don't know that I get a cervical bone, but I do love your tattoo.
Thank you. Thank you.
It matches what you do.
Yeah, exactly. So while she's doing her eye exercises, I'm, I've got a tuning fork in one ear. I've got something vibrating on her leg. So we're doing all this different stimulation all at the same time to give her the maximum benefit of everything.
Okay.
There's something in neurology that we call spatial summation.
When you do the first one, Dr. Sullivant, what do you find with that? When you're stimulating, what would you give me like the best success that you get from that?
Well, so the reason we do that all at the same time is because one, the therapies, they're not that invasive. For most patients, it's not going to be too taxing on their system. But because of that, we can kind of stack these therapies at the same time, because it's going to give the brain and the nervous system the most chance of plasticity, of change. Because that's what we're trying to do, is make a change in our nervous system, a change in our brain. And our nervous system is very plastic. So it changes really easily and very quickly. So if a patient is stable enough to handle all of that at the same time, that gives us the best chance at making a change as quickly as possible for the benefit. So when I'm doing those things, I'm also, getting feedback from the patient. We're retesting, we're rechecking things. I might put a pulse ox on them to make sure that their heart rate's staying stable, their oxygen staying stable. So we look at some biomarkers too, just to make sure that patient can metabolically handle all of that stimulation at once.
Right. Makes sense.
Yeah.
This is very fascinating. I'm loving this.
Awesome.
So this facility just opened. So how would you say, obviously I'm going to talk about how to find you after, but how many would you say of our MS patients, and I'm just going to say MS for right now, even know about this?
A small amount. 1%. I mean, functional neurology in general, I would say majority of the population doesn't know about it. It's a growing field. It's been around for 20, 30 years. I'd say the last decade it's really catapulted. It's because of research. The Carrick Institute works with a lot of different universities, and they put out lots of research now. And so the field that they've really catapulted in is concussion and sports therapy. That facility, Dr. Carrick, and then some of his other close colleagues, they work with elite athletes who have, have concussions and multiple concussions.
Love that.
Told basically they can't play anymore, and they've brought them back to playing.
Wow.
Sidney Crosby's a good example of that. He's a hockey player. He was told that he couldn't play hockey anymore. He went and saw Dr. Carrick. Dr. Carrick got him back to playing and playing better than he felt like he was playing before his concussions.
I wonder how many people know that story. I assume all of the hockey. I know my husband will know the story.
Yeah. And there's a really great YouTube clip of him from 60 Minutes. So if you just look up Carrick 60 Minutes, you'll find him talk about that story.
Love that.
And and so there's a lot of different athletes they've worked with. So they've really gone off on the concussion side of it, but it's applicable to so many different neurodegenerative conditions. There's practitioners that work with kids that are on the spectrum. There's autoimmune practitioners, migraines. So we start seeing now in functional neurology where now some people are specializing in specific conditions too.
Which is such a blessing, because for so many years we didn't have anything, and it was like, well, this is what it is, and this is how we're gonna deal with it.
I think the other reason a lot of people don't know about it is because of our healthcare system in general.
Absolutely. Don't get me started with that.
You're gonna it's not a covered benefit for
mine
insurance.
either. What I do the same. It's like, it's very frustrating.
Because of that, when you're in the system and you're trying to get some help, doctors are going to point you towards things that you have coverage for.
Right. Exactly.
And that's a tough decision for people to make too. You have to be committed to investing in yourself.
Yes.
And that's not easy for everybody.
Right.
So I think that's another part of it too. Hopefully we'll start to see that change. Yes. Healthcare, I think people are starting, at least the consumers are starting to realize that they want better options than just drugs and surgery.
Yes.
They want conservative care that is effective. So it's
would you say, Dr.
changing.
Sullivant, that after with COVID and so many patients being able to get together with different doctors and learning about this, that it's, I know for me, it's really changed my idea of, my neurologist is not my only person, where years ago, diagnosed over 20 years ago, that was your person. You had your regular doctor, and then you had your neurologist, and that was it. And so now this world has been opened up to so many of us. Would you say that you're finding it, and I know you just have the new clinic, finding more response from the autoimmune world because they have been so fed up with Western medicine and the doctor stuff? And
I think too, we have so much more access to information than we ever did. The internet has allowed us to be our own advocate and do our own research. And I think that has been helpful for people too. So the more information that we have at our access, the more options we have.
Right.
So I think that's been very helpful too. And I think in the last 3 to 5 years, people have, really gotten into health, nutrition, figuring out a better lifestyle, one that doesn't really, is not built on all the consumerism that we have in America.
Right.
I think people have kind of realized, our food's not that great here. We're on a lot of medication. We're over medicated. And I think people want something different. So it's starting to change, and hopefully the healthcare industry will continue to change with it.
I hope so.
Because I think overall, that serves people better longer.
Absolutely.
When you're on lots of medication, it's hard to have good outcomes because it's a snowball effect. You take one medication, you get side effects, and it snowballs to the next. So
100%.
So I think getting back to roots and eating good, giving your body the building blocks it needs, that's going to serve people longer, better.
Yes. I think that's where so many of us are. And that I'm hearing daily is that, I don't feel good on these medications. I'm being switched from, I just did this personally and got switched from medication that was working very well for me for a very long time. My body turned against it. Now I'm on one that I really don't like. It's not, Ocrevus is tolerated by many people, but for me, it's just, I'm not feeling my best on it. I'm feeling very weak and losing a lot of things that I'm just daily, logging and just looking at like what is happening. So I think with that and us understanding that it feels as if we're just getting shifted around to one medication, and then it stops working to the next, to the next, to the next, to the next. You're not sleeping. Well, here's another one. You're not being, you're not able, the spasticity is getting worse. Here's 2 more. So then before you know it, your whole drawer is full of medications that you don't even understand what half of them are doing anymore. So I think that being able to force to be slowed down in 2020, I think we really looked at what is this and what are we doing, and calming things down a little bit and being able to look at people like yourself and understanding that there's a whole world out there that for, again, my heart is always going to be for our young, newly diagnosed patients that can see this. I pray for the first time and say, there's something more out there. And for seeing healthier patients coming on and saying, yes, there is. And my goodness, it took to 2020 for the MS Society to say, exercise is a must for this many days. And I'm like, exercise and diet are the top 2 things, but it can be so frustrating. And like you said, with this whole healthcare system, they'll tell us massages, working out, right? So that's what I do, but it's not covered. So then we're asking our autoimmune clients to then come up with this money, and the same for yourself. And you want to help them. And then it really, I believe, comes to a place where a lot of them have to really make that decision. Like, how much do I eat out? How many Starbucks am I getting? How many Amazon orders are coming to my home? And can I take some of that away and put into what is most important, which is my health?
Yeah. And like I said, hopefully, with research and time, the healthcare industry will, change, or the insurance industry will change, where they start to cover those things. And then we'll see better access for it. But yeah, you're absolutely right. You have to sort of empower yourself and figure out what your health is worth to you. And not everybody's ready to make that commitment either. So, you have to be ready to make the commitment and make the change, and keep it up as a lifestyle, really, because when you have an autoimmune condition or a neurodegenerative condition, it's a lifestyle thing. It's a management thing. Even my patients that have pain, I see a lot of just, chronic pain patients, just because of the facility I work in. And I tell those patients too, same thing. This is a management thing. When you have a disc problem, and you have a herniated disc, you've had surgery, you're kind of past that point of where some people are at. You're going to have to work all the time to keep yourself feeling good, and change your lifestyle to mold that. And some people are willing to do it and put the work in, but other people aren't. And I just try to meet patients where they're at, and what they're ready for.
And I know that I can tell with you, I bet it's difficult as it is for me when I want it more than they do. And you see what you could do for them. And it's like, woo, I could do. And then it's like, they're not ready. And and I know that's very frustrating for me. I know, I can imagine it is for you as well.
Sure, definitely.
Yeah. So and this will be on the bottom of the show notes. So Dr. Sullivant, where can patients find you? I know you're at the Insight Chiropractic Clinic in Flint, Michigan.
So I'm at Insight Neurochiropractic Center. We are a part of a larger facility called Insight Institute of Neuroscience and Neurosurgery. So we are a multidisciplinary facility, and our home base is here in Flint. We do have another location in Warren, one opening in Dearborn soon, and we just acquired a hospital in Chicago. So we're growing, but I'm based here in Flint personally. But the nice thing about being a part of this system too is, one, I have access to a lot of different practitioners right here in the same facility. We have access to imaging. So it's a good system to kind of be a part of, because we can get you to the people you need to see a little bit easier than sometimes trying to navigate some of those bigger hospital systems. So like locally here, I have lots of patients who are in the McLaren system. It's hard to get to see who you want to see in that in that system sometimes. So the nice
thing those are from other states, what that feels like. Same thing. And Dr. Sullivant, my question would be, those in different states that can't get to you, what would you give to them as advice to how would we?
So there's a great website. That's the board's website, my neurology board. It's acnb.org.
Don't stress out. It'll be at the bottom of the show notes.
We'll put it on. They have a doctor locator there. So you can look up your state and find doctors in your state. The Carrick Institute is also a great resource. They would definitely be able to help you find a practitioner in your area as well, because it's a small community of doctors. We all kind of know each other. And so we all know someone who knows someone in a state. If we don't know somebody in that particular state. So that's the nice thing. It's still a pretty tight knit community.
Yes.
So we can definitely find you somebody. And what's cool about functional neurology is that, for me, I don't practice this way, but I have other colleagues that do intensives where you can go, if you don't have anyone near you,
yes,
you can go to their office for a week.
Okay.
Spend a week there. They do intensive therapy with you, 2 or 3 times a day.
Okay.
To get you stable with whatever's going on.
Sure.
And then they send you home with a care plan at home. They may try to find you somebody nearby to help kind of monitor your care plan. But there are offices that operate that way too. So that way, if you're not near somebody, you can maybe make the trip and spend a week and get the care you need.
Right. Love that. That's great information. Definitely will be at the bottom.
Yeah.
It was just great to find you and to be able to do this with you. Kudos to you. Thank you. You missed your lunch, totally missed your lunch today. And I know you have a packed day. So, really appreciate it. I'm looking forward to coming to see you. Yeah. And I know I'll have a lot of questions. I'm looking forward to the feedback with you, after this episode. It'll be featured in a few weeks, and also it'll be on YouTube for my listeners. And love everything that you're doing. Keep it up. Thank you for making it possible for us to have that different options than just what we always thought we only had. So
yeah, absolutely.
We do appreciate it. I'm looking forward to coming to see you. I'll be making an appointment. So
looking forward to it.
Yeah, have a great day, and thank you again. And what we always say is we came to disrupt what you thought you couldn't do. And we invite you to click and subscribe to Move It or Lose It podcast. And we just really enjoyed this interview with you, Dr. Sullivant. Thank you for making us aware. What a fascinating interview today. Thank you so much.
Yeah, thank you so much.
Have a great rest of your day.
Yeah, you too.
Talk to you soon.
Bye.
Well, thank you so much for joining us today on Move It or Lose It podcast, where you can again find us every Tuesday, and also wherever you like your podcast, whether it's Apple, Spotify, Stitcher. Join us on that, and we can't wait to see you again. We're going to have a lot of exciting guests and working together. And as always, you'll hear us say at the end of every podcast, we are stronger together. So let's do it. Let's become stronger together.